Hello everyone, welcome back to our channel. Today we are going to talk about what to expect in an IVF cycle. I'm Himanshu Burse. I'm working as a fertility specialist in London and Hertfordshire. So it is possible that you had your consultation, scan, bloods, nurse scheduling, you have completed all your consent forms and you are ready to start the treatment. So during your consultation, you would have been told about what to expect, but this is as a added benefit in case you had forgotten some details and if you want to go over them again. So there are two main protocols we use, a long protocol and short protocol. However, there are multiple variations of these protocols which you will be told about if there is a clinical need to add few differences to your treatment protocols, and they will be conveyed to you either by your clinician or the nurse with the reason for those protocols. So the long protocol consists of using either nasal drops or injections to start with, because we need to shut your ovaries down before we start the stimulation. Then you will have a scan to check the lining is thin, the ovaries are quiet, and then your stimulation will start. It is done with the hormone called FSH, follicle stimulating hormone. The trade name and the dose will vary depending on which clinic you are having your treatment. Once your treatment starts, then you will have regular scans and bloods from day 5 every 48 hours to see your response. And when there is a decent number of follicles from which we think we should be able to collect mature eggs from, then you will be given a trigger shot, and the egg collection will happen roughly 35 to 37 hours after the trigger shot. In the short protocol, there is no need to shut down your ovaries, and that's why the treatment will start with your period. The stimulation will start from the second day of the cycle, followed by regular scans and bloods every 48 hours from day 5 of your stimulation. You will be given a trigger shot when you're ready, meaning there are enough follicles from which we think we should be able to collect mature eggs from, and the egg collection will happen 35 to 37 hours after the stimulation or the trigger shot. Common issues to expect with stimulation. So the dose will be very individualized. It will be based upon your age, BMI, ovarian reserve, and medical history, because we want to keep your treatment as safe as possible. Now, one extreme which can happen is that there is no response at all, or poor response, meaning your ovaries will not respond to the medication, which is pretty rare. However, poor response can be quite common, especially when the ovarian reserve is on a lower side. The other extreme is ovarian hyperstimulation syndrome, where your ovaries are excited and produce too many follicles and too much hormone, and that's not good for your health. The mild form we are creating for a successful treatment. However, the problem starts if it progresses to moderate or severe OHSs, which can create quite a serious health issues, and that's why we will be regularly monitoring you, and then based upon your response, the dose will need to be adjusted. For the same reason, the trigger medication will need to be adjusted depending on the response of your ovaries as well as the levels of the hormones, and that will be conveyed to you by your team. The egg collection, it's performed under sedation, so it's not a full anesthesia, it's more like a dream. You'll feel something is going on, you won't remember anything, and you won't have any pain. And it's done with the same transvaginal scan, where the needle passes through the vaginal wall into the ovarian follicle, and we collect your eggs. Once the egg collection is done, the process of fertilization happens, and we'll use your partner sperms or donor sperms depending on the clinical situation and what you have agreed with. IVF, which is in vitro fertilization. So these eggs and sperms are mixed, and we use this method when the semen analysis has been absolutely fine. The other method we use is called ICSI, that is intracytoplasmic sperm injection, where a healthy sperm is injected into the egg rather than mixing the eggs and the sperms. And this method is used when semen analysis is suboptimal, or we are using donor sperms, or there has been a clinical need in spite of semen analysis being normal. And again, this will be conveyed to you by your team. The monitoring of embryos happens once they are formed. They are kept in an incubator and monitored very closely at regular intervals to check their growth and health. The embryo transfer will happen usually after day 5 of your egg collection if you are going for a fresh transfer. In certain clinical situations, the embryos might need to be frozen, and the frozen embryo transfer will happen at a later date. And in certain clinical situations where there is a need, we have done transfer on day 3. The transfer does not need any anesthesia or sedation except certain exceptional clinical situations. The top quality embryo will be transferred into the uterus, and majority of the times it will be a single embryo transfer. In rare clinical situations, we do use double embryo transfers, and any surplus embryos, if available, they will be frozen for future use depending on which consent you have given us to do that procedure. Once the embryo is transferred, you will be offered medication to support the pregnancy. The pregnancy test you will do after 2 weeks of embryo transfer. If the test is positive, then we will arrange a scan around 6 weeks to make sure that it's a single embryo, it's in the right place, and it's growing in the right direction. Unfortunately, if the pregnancy test is negative, you will have an appointment to see a clinician to discuss your cycle, your response, and discussion about future plan. What precautions you will be taking during your treatment is to make sure that you're physically and mentally healthy and willing to go through this treatment. Your diet is balanced, you are taking enough sleep and rest. Ask questions throughout the treatment, and the team will be more than happy to answer every query. No question is a silly question. If you're worried, and we will welcome any and every question, and we'll try and answer your questions to the best of our abilities. The counseling is available at every step of the way, before, during, as well as after the treatment. So if you feel there is a need, please do avail the facilities. Always remember the timings for your medication, and we had a few instances where the timing was misread and the trigger shot was missed, and then we had to unfortunately cancel the cycle. And these treatments are emotionally, physically quite taxing, so it is very unfortunate when these things happen. So please make sure of the timing of your medications and clarify your doubts if there are any, and speak to the nurse or doctor if there are any other issues throughout your treatment. Thank you.